Jai Hind, dear students. I'm Dr. Preeti Mittal, and today we are going to discuss about the reproductive health and various contraceptive measures. This is the last topic from your reproduction chapter. The first question that comes is, what is reproductive health? Reproductive health refers to general well-being, overall well-being of a person, which includes the physical as well as the mental health. So the person should be healthy physically as well as mentally. Then comes, what are the contraceptive measures? What is the meaning of contraception? So different measures could be adopted to avoid pregnancy, and this avoiding the pregnancy only is known as contraception. Now, what is the importance of contraceptive methods? Why a person should adopt contraceptive measures? So, this is very important that the person should adopt some or the other contraceptive methods because of the following reasons. The first reason is maternal health, health of a woman. That is very important because if pregnancy is there, that creates a lot of stress and demand on a lady's health, because we have read in the previous topic that if a lady is pregnant, then all the nutrients to the baby are provided by the mother. All the calcium for the bones development, all the nutrients, proteins, whatever is there required for the growth of the baby, that will be provided from the mother's body, and that really creates a lot of demand on the female's health. If the number of pregnancies is more, then the stress on a female's health will also be more, and so it's really required to regulate the number of pregnancy, and that could be done by using various contraceptive methods. The next importance of contraceptive methods is population, regulating the population size. Population is really expanding at a huge extent. We have become one of the most populated countries, so we need to regulate the population growth by checking the birth rate. Next is the preventing some sexually transmitted diseases. Some sexually transmitted diseases could be prevented, but not by every contraceptive method. That is possible with mechanical barrier method. If a person is adopting mechanical barrier method, we'll discuss what's that. So that mechanical barrier method will be helpful in preventing sexually transmitted diseases. The next very important question for your exams, make it a star, is name two bacterial diseases and two viral diseases which are transmitted sexually. So sexually transmitted bacterial diseases includes gonorrhea and syphilis, and sexually transmitted viral diseases includes AIDS and warts. Okay, sometimes the students writes AIDS and HIV. These are not too different. The causative organism of AIDS is HIV, human immunodeficiency virus. So the two diseases for both viral as well as bacterial, it's very important for exams and you should remember that. Fine. Now comes the various contraceptive measures, which we are going to discuss next, the various contraceptive measures. So the first contraceptive measure, for every contraceptive measure, we are going to discuss that whether ovulation will be there and what are the probable side effects of that particular method. Okay. So first contraceptive method is mechanical barrier method. Mechanical barrier method prevents direct contact between the male and the female reproductive organs, and so it prevents the entry of sperms into the female reproductive tract, so that the male and the female organs do not come in direct contact with each other and the sperms are not able to enter into the female reproductive tract. If the sperms are not going to enter into the reproductive tract, then definitely pregnancy will not be there. Okay, so this could be in two forms. It could be adopted by a male in the form of wearing a condom over the penis during sexual intercourse, or it could be adopted by a female by wearing a vaginal cover. A similar cover is available and that is worn on the vagina by the female, and that will prevent the entry of sperms into the reproductive tract. Now, will the ovulation be there? Yeah. ovulation will be normal, hormonal balance will be normal. So that will not be having any problem with the hormonal balance of the body. Side effects of this method is not mentioned in your book, and it usually not cause any side effects except for the for some local irritation of the parts could be there. Next comes the oral pills. Oral pills involves the taking of some medicines, some tablets are given to the lady, and that she has to consume, and that will alter the hormonal balance of the body, and that is going to prevent the ovulation. Means the ovum will not be released, ovum will not be formed properly, it will not be released, and so if ovulation is not there, then obviously pregnancy cannot occur. So this is the mode how it is going to affect, and definitely its side effect is hormonal imbalance, because it causes some imbalance of the hormonal system of the body. Next comes copper T or loop. These are the devices which could be placed inside the uterus by a doctor or medical person. So that is placed inside the uterus, and that is going to prevent pregnancy. That will not allow the implantation of the embryo in the uterus. So will the ovulation be there? Yes, ovulation still will be there. It will not be having any problem with the hormonal balance of the body. Hormonal balance of the body will be still maintained. So just remember, hormonal balance is like disturbed only by the use of oral pills, because it affects ovulation. Rest all other methods, ovulation will be there and there will be no hormonal imbalance. So in copper T, what will could be the side effect of that? That is irritation of the uterus could be there in some cases, because it's placed inside the uterus, so that irritation of the uterus could be like a side effect of that. Next is the surgical method. Now the surgical method could be adopted by a male or a female. You could be asked in your exams that which contraceptive measures could be adopted by a male. So use of barrier method, that is use of condoms, and the surgical method. These two methods could be adopted by a male. And which of the methods could be adopted by a female? So any of the four measures could be adopted, but which of the methods could be adopted only by a female? So that is use of oral pills and copper T. Okay, these two only females. These two could be done by both male as well as female. Now, surgical method. Surgical method involves blocking of the pathway of the gamete. So in case of males, the vas difference is blocked so that the sperms do not come into the urethra, that will not be passed out of the urethra, and so there couldn't be the chance of pregnancy. Vas difference of both the sides, it's blocked. Okay, so that is done as a small operation in a male. A similar operation could be done in a female, that is by blocking the fallopian tube. You know that the uterus, the ovum is brought to the uterus by the fallopian tube. So this tube-like structure could be blocked, and that will prevent the ovum meeting the sperms and thus prevent fertilization. Will the hormonal balance of the body be disturbed? No, it won't be disturbed. Ovulation will be normally there. In the male also, sperm production will be there, and the semen regulation will also be, semen discharge will also be there because of the secretions from different glands, like we have seen some anal vesicles, prostate gland. They will be still producing the fluid that will be coming in the urethra. So all those things will not be affected, but the only thing is that the sperms will not be there in the fluid, and so pregnancy will be prevented. So these are the some contraceptive measures which could be adopted by a couple to avoid pregnancy. And apart from that, still if these methods are not used, then also still there is an option that unwanted pregnancy could be removed surgically also. That is known as medical termination of pregnancy, that could be done, but that shouldn't be just for removal of the female baby. Okay, the only problem with that is that if unwanted pregnancy is there, so that is usually that removal of the fetus is done in that case, and that is many times adopted by the people just to remove the female baby. So that is really very unethical, illegal also, and that shouldn't be adopted. Okay, so that's all for this chapter, for this topic. I'll just shift to side. You can take a screenshot if you want everything in to be in a nutshell. So I have summarized everything about a topic on the board. You can take a screenshot. That's all for today. Good day, everyone, and good luck as well.